And Edmonton was the first and still one of only a few Canadian cities offering it. Susan Amarangan is back now and joins us with more details on this story. Sue.
So Carmen, it's called NICaS and it stands for non-invasive cardiac system.
So you're going to feel for a pulse, look for arterial pulse on her, and get a good pulse there.
In a demonstration, Ray Popovich places an electrode on Megan Dunn's wrist, another on her ankle. Within a minute, the laptop screen shows what's happening in her heart.
So how effectively it's pumping, how fast it's pumping, the volume that is pumping.
If it seems simple, that's because it is. Popovich calls the NICaS amazing.
I've never seen nothing like it.
Not only does it provide quick results, it's easy to set up, and it's far less invasive than the traditional monitoring method, which involves the insertion of a catheter carefully guided through to the heart. Popovich says that takes a lot of time, and it comes with risks.
Putting a line near the lung could potentially have a pneumothorax or put some air inside the lungs where we don't want it to be.
I've always been a big fan of simpler is better.
Dr. Randall Williams says thanks to the Royal Alexandra Hospital Foundation, the Heart Centre has 2 of these devices and is the first site in Canada to use it.
Basically all the important stuff we want to know in a sick patient to help manage them better. And now we can get it relatively simply at the bedside, in the clinic. We could get it in Tim Hortons if we wanted to. It's that simple.
It's also less costly.
Key technologies in this area is whole body impedance cardiography. So just the same as you have an electrocardiogram, you can inject some current into the body and you can get a impedance cardiogram. And this can tell you both about systolic events and diastolic events. It can give you a measurement of cardiac output. It can give you a measure of body water, and potentially it can also give you some idea about left ventricular filling pressures. These are very simple devices. You can do an arm, ankle, wrist configuration with these electrodes, or you can give a wrist-wrist configuration for patients. In terms of accuracy, I think they look better than the relationship when we compare some of the invasive techniques. So, and of course, one of the things we do need to recognize is that we see thermodilution as the gold standard, but it's only because it's the best that we had at the time. I suspect that there is a fair amount of inaccuracy in the thermodilution technique. Bioimpedance could become the new gold standard in terms of measuring cardiac output. Normalizing blood pressure, normalizing cardiac output, hopefully normalizing filling pressures and pulmonary artery pressure, you might be able to replicate the results of the CHAMPION study and alter the outcome of the patient.